Part of our program development process that we went through as we developed this program or this expansion of program is we ask our patients, what can we do to enhance this treatment experience for you? What can we do to help you engage in care in a more meaningful way? And we got pretty resounding feedback around visitation. So in adult psychiatry, generally patients under age 12 are not allowed to visit in the traditional visitation space. It's a safety component for the safety and welfare of the child and often for the patient themselves. But we recognized, especially last year, we had several postpartum mothers dealing with severe depression. And because of the constraints we had, we couldn't allow them to see their baby. And that was not conducive for them to continue treatment in the way that they needed to. And we recognized from their feedback and the feedback of others, we need to develop a mechanism where we can make a clinical exception as appropriate. And so that is to provide a visitation space outside of the treatment or residential area with physician orders. So when this facility opens, any patient that we're providing care to, if they have underage family members that they want or need to visit with, our psychiatrists will evaluate the patient, will communicate with the family. If it is clinically appropriate for the patient and for the underage participant, then we'll write a physician order, schedule a visitation, and allow that contact. Based on our patient feedback, we know that that will help people continue to engage in care in a more meaningful way. Because a deterrent to continued care is often, what's going to happen to my family? What's going to happen to my job? What's going to happen to my home? And if we can take some of those stressors away and we can engage that family in the course of treatment in a more powerful way, we have now equipped that human being for more of a likelihood of success post-discharge. So we've designed a visitation room. You'll notice has a lot of windows, has a lot of visibility. So while our visitors won't have access to the direct clinical environment, we want them to see where their loved one is being cared for, what it looks like. We want them to have that sense of safety that happens when you can have confidence in the course of care that the person you loved most in the world is receiving. We hear stories all the time from moms and dads who maybe it's their child's first ever inpatient admission and they are absolutely terrified. And unlike in medical services pre-COVID, where you could stay with your child or you could stay with your spouse or you could stay with your mom, psychiatry doesn't have that opportunity. So we wanted to create that as much as we possibly could, because the health and wellness of the family and significant others in that human being's life is just as important in the course of recovery as for the patient themselves. So everything we've done, we've really tried to design around that concept and create an experience, not just an admission.